Here I kind of wrote out my pros and cons of bariatric surgery versus GLP-1s. And don't get me wrong, I do GLP-1s. I think there is a sweet spot for them. I use them for people for maintenance after bariatric surgery and also before, sometimes when people need to lose a little bit of weight before surgery. Now, from a GLP-1 standpoint, these being Ozempic, Mounjaro, there's a million of them. You've seen them everywhere. They're more of a short-term thing in my mind. For people who do it, they lose a little bit of weight, 15, 20 pounds. However, for our bigger patients, they're not able to lose 100 pounds like you would see more with bariatric surgery. These are weekly injections that become cost ineffective over time. They're expensive, insurance often doesn't cover them, and it becomes a hassle. We've also seen that when people stop these, they end up regaining a lot of weight that they lost. And so unless you're planning to continue these medications indefinitely, they may not be the best option for you long term. The other thing that we're seeing is there's many side effects that are now becoming apparent as more and more people use these drugs long term. Pancreatitis, nausea, vomiting, constipation, and gastroparesis. In the newer data, when you look at it, people are losing, at every 10 pounds, 2 of that is coming actually from their muscle and from their bone. Now, when you compare that to bariatric surgery, that being gastric sleeve or gastric bypass being 2 of the primary ones that we do here, this is a more long-term option. It is a little bit more expensive up front, but over time it actually becomes more cost-effective when compared to the injections. More durable and sustained weight loss. They're able to maintain that long-term if they make the appropriate lifestyle changes. And typically we see about 60% of people's excess weight being the estimated weight loss.